Palliative care refers to specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness such as cancer, HIV/AIDS, and among others. Report indicates that many Ugandans die in facilities such as hospitals or nursing homes receiving care that is not consistent with their wishes. As a way of extending palliative care services to the communities, Palliative Care Association of Uganda held a camp in Luweza, Wakiso district, where many young people were trained on how to administer palliative care to people within their vicinities. This also traversed the community of Luweza, providing different forms of care to the residents in need. Speaking to the media, the Executive Director, Palliative Care Association of Uganda, MacDonald Mwesgwa, called upon the government to allocate resources for home care since many Ugandans are now leaving hospitals and resorting to home care.
Many people who are discharged, having suffered life-limiting illnesses, are going home, and they're not going home to cure, but they are going home to live with their sickness as they transit into death now. We need our healthcare system to appreciate that there are people who are bedridden in homes, and it is costly for anybody to come from a home to the facility. So we need our healthcare system to go home. So we are appealing to government to allocate resources for home care.
He says that there is more need in promoting primary health care and diagnosis of diseases earlier than later.
We have also been advocating and asking government to allocate resources for primary health care, for more prevention, for more disease prevention, for diagnostics to be closer to the people, for people to know that they can come into a health facility and have investigations that are real, and then they are treated and cured.
Mwesgwa also emphasized the government to include palliative care into the public health care system, saying this will help patients being looked upon as a whole rather than just individuals. He has called for recruitment of more trained healthcare workers to administer this form of care.
We have also been advocating for this government to make sure that the concept of palliative care is really entrenched and structured within the public health system, with that the qualified health workers are recruited, that if anybody comes with a life-limiting illness at a hospital, is looked at as a whole human being. Not only to look at the physical, but the social, the psychosocial, the spiritual, and also the physical are looked at. So because many people who are ailing will come into a health facility, we have also been appealing that let the medicines be available, including pain medicine and all the medicine that people need, including at the lowest health facility, because the majority of the people, as I explained, who are bedridden in homes, who are really sick in homes, will find the first line of response being the nearest health facility, because it takes a lot of time and resources to transport them from the home to the facility. So we have been really emphasizing those notions.
More so, Mwesgwa appreciated the role played by the government in as far as healthcare is concerned, but called on Ugandans to do early and regular medical checkups and improve their lifestyles by avoiding unhealthy behaviors such as alcoholism.
The government of Uganda has done a lot of good work in as far as palliative care is concerned since 1993, when palliative care was introduced in the country. And we appeal to the government to continue supporting palliative care, to continue supporting the Uganda Cancer Institute, which is doing a lot of good work, to make sure that the regional cancer centers are supported and they are in place, and that people who need care can receive it. And then to the public, we continue to appeal to them to do health checks whenever these are possible and available, and to continue to improve our lifestyles and make sure that our lives are not wasted in taking a lot of alcohol, in really tobacco use, in making sure we're sitting long and not exercising, in making sure that we are part and parcel of the groups of people that influence our lives positively.
Today's Palliative Care Association of Uganda Road to Hope 2024 camp has been organized under the theme Compassionate Care Beyond Self. Some of the students who participated in this camp highlighted some of the benefits they gained.
I was not actually afraid of helping these people because we signed up knowing what we're getting ourselves into. And so being able to actually help is by actually doing them physically and not just sending people that, okay, go help this person. No, if you want to actually help someone and feel like you've done an impact yourself, you have to get physical with it.
At my level, I always help people in our village, like those elderly. I help them, fetch them water, sweep for them the compound, wash for them clothes. Then at school, I help my friends. They don't have pen, they lack books, they are sick in the sick bay, they lack sugar.
Rosie Chiwanuka, palliative nurse, explained the reasons for organizing this camp at such a time.
As you can see, we have these children in a camp which we call Road to Hope. It is called Road to Hope Camp. And we are bringing these children together to kind of encourage the spirit of love, kindness to each other, because palliative care is about that. Some of these children have taken care of their own parents, so when they come together and then see such an activity in the community, get involved in it, they're kind of giving back, but also emphasizing the compassionate care, because the theme is compassionate care beyond self, and we are moving around to kind of support other people as well.
Composed of over 1,300 individual members and 25 member organizations, Palliative Care Association of Uganda is the national association for palliative care providers in Uganda. John Baptist Ahumuza, Church of Uganda, Family TV News at 8.